Good afternoon. Welcome to the press briefing. With us, we have Dr. Zhang Chukwan, Head of Communicable Disease Branch from CHP, Dr. Gladys Guan, Chief Manager from Hospital Authority, and Professor Lau Yulong, member of COVID-19 Advisory Panel. Dr. Guan will give us an update of HA, and then Professor Lau on mobile information, and Dr. Zhang on the latest situation. Dr. Guan, we have 1,384 inpatients, among them 155 new confirmed patients. For those receiving isolation, 434 patients are in isolation ward, 24 in second-tier isolation ward, 424 in ICC North Lantau Hospital. 126 of them are newly confirmed patients. Yesterday, we've newly reported 5 cases of critical condition, 2 in serious condition. For inpatients, we have 22 critical and 11 serious patients, respectively. 6 are receiving care in ICU. We've also reported 5 new cases of death yesterday, 3 male and 2 female, aged between 56 and 100. 2 of them are from care homes. 2 had 2 jabs, 2 had 3, and 1 had no vaccination record. I'll briefly outline the cases to you. For the first case is a 68-year-old male who had 3 jabs, and he, because of hepatitis B and liver cirrhosis, he has had liver transplant, and he also need renal dialysis because of renal failure. On the 16th of July, he was found unconscious at home. When he arrived at the A&E department, he was receiving resuscitation, and then he was taken to the ICU for care. His condition continued to deteriorate and passed away yesterday. The second is an 88-year-old female with diabetes, hypertension, and stroke because of a fall. Accidentally, she was hospitalized and confirmed on screening via admission because she had pneumonia and pulmonary edema. Her condition deteriorated and passed away yesterday. And then the third is a 56-year-old male with hypertension, diabetes, and then also he suffered a serious stroke in the past. He could not care for himself. In early July, because of fever, he was hospitalized. And then his lungs continued to deteriorate. He required assisted ventilation, and then he passed away yesterday. And then we've got a 104-year-old female with diabetes, hypertension, and also Parkinsonism. And because of fever and listlessness, she was admitted. Her condition gradually worsened, and she passed away yesterday. The last case has got a long coronary heart obstruction, lung obstruction disease, and require oxygen. And then I fainted at home, and on arrival there was no heartbeat, and then tested positive by RAT. The case has been referred to the coroner's court. Among those in critical condition, we've got a 22-month-old baby girl. She had fever yesterday, and then she was sent to the Eastern Hospital by ambulance, and she is in critical condition and require medication to strengthen the heart and also intubation. I give the floor to Professor Lau. Good afternoon. I'm here this afternoon because yesterday a 22-month baby who lives on an outlying island. She has some fever and chills and also coughs. Around 7 p.m., family members found she had seizures because the baby lives on one of the outlying islands, and then the case went to a family physician on Chang Chao. It was decided that the case should be sent to an HA hospital as soon as possible. So the case was transferred to the Eastern Hospital by helicopter. the case arrived at about 9:30 p.m. Those seizures started at 7 p.m. So the condition lasted for a few hours, 2 to 3 hours. The situation was worrying. This morning, HA staff and also staff of PYNEH discussed with me. We understand that the case is now in critical condition in ICU. Intubation ventilator is administered, and medication is needed to sustain her life because the case has seizures, and there was also listlessness, and there was worry that there could be some problem with the brain. It could be an acute ischemic brain infection caused by COVID. The case has been hospitalized for less than 24 hours, and colleagues of Permanent Youth, Netherso Eastern Hospital are doing different diagnoses, including a brain scan and ECG, and then MRI was just done in the afternoon, and we're receiving WhatsApp messages from colleagues. But then the lesion is quite serious, and there is also brain edema, and we have to rule out other possibilities. But according to circumstantial evidence, the case has an elder sister, and then she tested positive by RAT on the 27th of July. Because for a baby 22 months old, there is no vaccination. So it's not unusual that there could be some problems. I understand that many parents are worried. So CHP and also hospital authority would like me to talk about what is encephalitis. Now, for those who have followed through COVID conditions, you don't have you must have heard this. There have been perfectly healthy kids who suffered from encephalitis because of a COVID infection, and some of them passed away, and then some took a while to recover. So encephalitis is inflammation of the brain. And what are the symptoms for COVID? Is fever, and then listlessness. A child who's usually playful may appear who has no interest to play, and seizures and convulsions. And if the seizure lasts for 5 to 10 minutes non-stop, then parents should be aware and seek medical assistance as soon as possible. It's not always easy to pick up seizures in very young children. There may just be some listlessness, and also a rolling of eyeballs for a few movements, and also twisting of mouth and unable to communicate. Usually a 22-month baby would be very active. And if at any time you find the kid unwilling or not interested in playing and not communicating with you, you should seek medical assistance as soon as possible. Unfortunately, the family lives on an outlying island, so it was always convenient to seek medical help. And so the case was transferred to Changchao, and then it was taken to Eastern Hospital by helicopter. So that's unfortunate. And secondly, now Omicron is prevalent. We do not know what subvariant is affecting us. We have BA2 in the main, but there is also BA.4, 0.5. The CT value is very high, it's around 22. So we should be able to isolate the virus and do sequencing to find out whether it is BA.2 or 0.4, 0.5.
There are differences between BA2 and BA5 and their characteristics. In terms of BA2, from February to April, we analyze cases among children carrying the BA2 subvariant, and the literature could be found online. You can refer to the 6 relevant slides, which were shared already. Compared with the common flu, BA2 can lead to brain diseases and encephalitis. It's 1.8 and 1.4 times higher than the common flu and the flu. And so compared with the likelihood of being admitted to the ICU is 2.5% higher. In Singapore, there were cases of fatalities among children due to COVID-19. A 4-year-old girl passed away due to encephalitis, and they carry different viruses. And a university from Taipei conducted a research analyzing the symptoms in the neurosystems or the nervous systems of children, and some 30% were found to have issues with the nervous system. About 20% suffered a stroke, even though they did not die. Since there was some encephalopathy, the patients needed a long time to recover. And one might wonder why these children suffered such serious implications, since they were not vulnerable or old. While that could be a valid claim most of the time, since children are still young, some inherited immunodiseases were yet to surface, and many researches have been conducted all around the world for children who are healthy but somewhat suffered serious COVID-19 complications. They might suffer from inheritary immunodiseases. So if this is the case, by getting vaccinated, the relevant risk could be reduced. So at the end, we would urge everyone, including children, to be vaccinated. I'd like to thank Dr. Chuang and the team at the Department of Health for providing figures from the beginning of the year till April the 19th. We analyzed the age sectors of 3 to 11 years old and 12 to 18 years old after vaccination. For the 3 to 11-year-old sector, vaccination only started in January or February, while the 12 to 18 age bracket vaccination started for BioNTech at the middle of last year and Sinovac at the end of last year. You can scan the QR code for details of the data. For the 3 to 11-year-old age bracket, while the take-up rate for the first dose reached 50 to 60%. For the second to last slide, well, again, you can see the details by scanning the QR code. Peer review is currently being carried out for secondary school students, whether they receive the Sinovac or BioNTech jab after receiving 3 doses. The protection rate against BA2 is 86 to 92%. For BioNTech, it's 86%. For Sinovac, it's 92%. But no direct comparison could be drawn since the timing of vaccination is different. According to figures provided by Dr. Chuang yesterday, only 40% of secondary school students are fully vaccinated. So I urge them, only 40% of secondary school students are fully vaccinated. For kindergarten and primary school students, at the early phases, only 2 doses of Sinovac or BioNTech could be administered, but even 2 jabs could offer a protection rate of 30 to 40%. Yesterday, Dr. Chuang shared with us figures for 3 to 4-year-olds and 2 to 3-year-olds, only 50 and 30% receive 2 doses respectively. For the 5 to 11-year-old bracket, only 60% received 2 doses and only 6% received 3 doses. Most of them received the Sinovac vaccine, so many are yet to receive the 3rd dose. So I urge all parents to have their children vaccinated on time. Well, we have printed a copy of the summary. If we compare secondary school students with primary school and kindergarten students before the 5th wave of Omicron arrived, the trend for kindergarten and primary schools were very similar. We prevented 55,000 cases of COVID among secondary school students and 3,000. We prevented some 3,000 cases among primary school students since vaccination started rather late. So for those under the age of 3, what are we going to do? So today we have told you about the 22-month-old child who is in critical condition at Family Youth Netherlands Eastern Hospital. So the key is how we can vaccinate children under the age of 3. So hopefully in the coming weeks, the Joint Scientific Committee can deal with the issue. Over the past day, 155 patients recovered, including 142 who have been discharged. Another 5 students were found through admission, screening, or in-hospital testing. 9 patients and staff members were listed as close contacts in the ward. For staff members, a total of 25,890 tested positive so far. 25,321 have returned to their posts. As for the testing requirements for visitors, we have a new announcement. In order to curb the risk of transmission into hospitals and to protect our students, since August the 1st, the HA would update the testing requirements for visitors. All special visitors, including COVID-19 recovered patients, they must provide a valid COVID-19 PCR negative result within the last 48 hours. Visitors can conduct the tests at their institutions of choice, but the relevant institution must provide combined swab tests. And this also applies to compassionate visit arrangements at special wards. For patients who had to be tested at community testing centers, the testing fees could be waived. For urgent cases and terminal patients, the current testing requirements would remain unchanged. That is, visitors can produce a valid PCR negative result within the last 48 hours or a valid RAT result in the last 24 hours. If visitors provide a negative RAT result before the visit, they must complete a PCR visit as soon as possible after the visit and share the result with us within 2 days. In case of emergencies, if no valid test result could be produced ahead of the visitors must complete a RAT as soon as possible after the visit and share the result with us, and to conduct a PCR test as soon as possible and produce a result within 2 days. All visitors must also comply with the vaccine pass requirements, and when entering public hospitals, they must scan the Leave Home Safe QR venue code. And later, we will issue a press release to announce details of such arrangements.
Good afternoon. Yesterday, we had 4,638 confirmed cases, 1,786 of them PCR positive and 2,882 by RAT. We've got 248 imported cases. Of them, 222 are PCR positive and 26 RAT positive. As Dr. Kwan mentioned, we have got 5 cases of death reported. So in the 5th wave, the total number of deaths are 9,280. Among the 248 imported cases, we have 102 cases picked up at the airport, 125 at quarantine hotels, and 21 after they have left quarantine hotels. These 248 cases came from 44 places, with 6 importing 10 or more cases, including the UK 42, the Philippines 26, the US 22, Thailand 20, Singapore 19, and in India 10 cases. For the remaining 38 cases, they have imported 10 or less cases. For care homes, we have got 5 elderly care homes with cases requiring quarantine of close contacts. 頤和園護理中心 in Hong Kong, Kowloon City, with 3 residents confirmed. 29 persons have to be quarantined. Pok Oi Hospital, Jockey Club, Care and Attention Home in Yuen Long, 1 confirmed case today. 11 residents have to be quarantined. Hong Kong Lutheran Services Center, 梁繼夫人 Elderly Care Home, 1 resident confirmed. 9 residents have to be quarantined. 院院護養院暨長者日間中心 at Lane Mukshia Estate, 1 resident confirmed, 2 residents to be quarantined. 保良局有5年期樂居 1 staff member confirmed and 6 residents to be quarantined. For schools, today is Thursday. 315 schools have reported 409 cases to us. 330 students and 79 staff members included. In the past week, 197 schools have reported 2 or more cases to us. Today, we have 7 schools where classes have to be suspended for a week. Shin Kong Wei St. Joseph Kindergarten in Yuen Long, K2 AM 兩線班, 2 cases in a class of 18, so class suspension for 1 week. Characters, Luk Jun, a special school, in a class of 10, 1 confirmed case. Because it's a bit hard for the students to wear face masks, so class suspension for 1 and quarantine for 1 week. 靈養堂 Sau Dak Primary School on Outlying Island, 3 cases in a class of 24, class suspension for 1 week. Another special school, Characters Lok Yi School in the Eastern District, in a class of 8, 1 confirmed case. Again, hard for them to wear masks, so class suspension and quarantine. Muk Yan Secondary School in Tai Po, 3 cases in a class of 29. Sam Shui Po Public Primary School, class 4B, 3 cases in a class of 30. Tonghua Group of Hospital, 來裕積小學 in Yau Chim Mong, in a class of 24, 3 confirmed cases, so class suspension for 1 week. Subvariant suspected to BA.2.1. The percentage is about 3.8%, BA.4 or 0.5, a rising trend as well, about 2.4% of the cases. That ends my report to you today. I open the floor. Please raise your hand and use the microphone. We hand over to you and introduce the organization represent. That gentleman in blue. Good afternoon. Good afternoon. I'm from Now TV. For the 22-year-old baby girl, was there a delay in medical treatment? And because of that case, would there be any suggestions for improvement in remote areas to facilitate COVID patients elderly and young patients in particular to be sent to hospital. As Professor Lau mentioned, the baby girl was too young to receive any vaccine. You're going to meet next week to discuss vaccination. Have you got any data from Sinovac? I'd like to know whether it's a preliminary consensus of experts that this will be done. A question for HA. You mentioned this new measure, that is a PCR negative result within 40 hours of a visit is required. Now, there are people in the industry saying that it's difficult to perform PCR tests for the elderly. So will you have any flexible arrangement in the early stage of implementation? And for compassionate visits, can you give us some concrete examples of how that will be done? The last question. Yesterday, it was announced that private hospitals in the first stage will make available 300-odd beds for HA to use. Will you activate the system of having dedicated hospitals for COVID patients, and non-COVID patients will be channeled to private hospitals? And what is your preliminary thinking on public-private sector collaboration? Professor Lau. Hong Kong is a very densely populated city. Of course, we have outlying islands. And the problem is support is reduced at night. For residents of Changchou, they can go to St. John's Hospital to see the resident doctor. But for Pingchao and Lama Island, they do not have such services. They will have to seek a Kaito service. I think parents are doing their utmost. Many kids who have contracted COVID will develop a fever, in particular for those who are not fully vaccinated or not yet vaccinated. So when a slight seizure appears, now I haven't got all the information, but according to my colleagues, the case was transferred to the Eastern Hospital within a few hours. You can imagine with a family with 2 kids, well, one might have developed a seizure which is not easily recognized. So they have to send the case to St. John's at first and then send to the Eastern Hospital. Now, for someone living on Hong Kong Island, normally it's very quick for the case to receive medical attention. It might be very quickly transferred to a hospital for treatment. Of course, parents should be aware that it can be serious for a young kid to contract COVID. I know for that family is doing very well. The elder daughter has already been vaccinated. So if a young kid appears listless and is not willing to play, and rolling of eyes, and also rolling of eyeballs, and twists of mouth, and that may be some signs. For major seizure, of course, is easier to recognize. So if there is non-stop seizure for 5 minutes, immediate medical attention should be sought. There can be no delay. On whether we can have fast services, I don't know, but I believe there hasn't been any delay. As regards how we can make it easier for residents living in remote areas to see a doctor more quickly, I don't have any concrete plan. I can only appeal to the public to have their children vaccinated as soon as possible if they are eligible. Because of a vaccination, we can greatly reduce the risk.
Dr. Chuang told us about the serious cases yesterday. We saw that those under the age of 2 were most vulnerable, while the 2 to 5 age bracket was rather vulnerable, and they were more vulnerable compared with secondary school students. For 0 to 2, for every 1,000 patients, around 2 were in serious or critical condition or even died. So the situation is rather precarious in Hong Kong. And since the fifth wave started as of July the 23rd, there were 19 cases of patients in serious or critical conditions or death among 2-year-old, 3 to 4-year-olds, 15, 5 to 11 years old, 20 cases. For 0 to 2 years old, 2.5 per 1,000. For 5 to 11 years old, around 0.5 per 1,000 patients. So the ratio is much higher than secondary school students. For secondary school students, only 1 in 10,000. For 0 to 2 years old and or those above 80 years old, they are the most vulnerable, and we must identify them and get them fully vaccinated as soon as possible. Before the meeting yesterday, the two chairmen, together with Dr. Chuang, looked at the relevant figures. Above the age of 80, 120,000 are yet to be vaccinated. 60 to 69 years old, 130,000 are yet to be vaccinated. For 5 to 11 years old, 800,000 are yet to receive any jab. For 3 to 4 years old, 33,000 are yet to be vaccinated. So altogether, 500,000 people did not even receive one shot. I believe the daily RAT tests for schools are necessary. And for all the positive cases, we must know about the subvariant, that is BA4, BA5, etc. That's why the data reported by Dr. Zhang every day are very important. And we want to see whether BA5 is more fatal in Australia. The caseload is mounting, and a lot of patients are being hospitalized, and that has created a stress for the healthcare system, and the death toll is also rising. So we must take out necessary measures to avoid affecting our economic activities. So we do need to analyze the cases. With more cases, there will be more serious cases or deaths. So every 2 weeks or so, we saw a serious case among children. So the priority is to get vaccinated. Dr. Kwan, in terms of the new visiting arrangements, we all know that hospitals are important facilities. We want to minimize the risk of the virus entering hospitals. That might bring inconvenience to some members of the public. But this is an important measure to protect our patients. So for members of the public who encounter difficulties as a result of this arrangement, you can get in touch with our staff, and we will see if we can render assistance. For those who are not able to visit, we are experimenting with a remote visit arrangement for terminal patients whose conditions are deteriorating rapidly. Their family members might not have time to complete PCR tests, but if they can complete an RAT test and produce a negative result, we would allow them to visit their family in the hospital. So long as they provide a negative PCR result within 2 days afterwards, we will provide the full details later. In terms of our collaboration with private hospitals, since the fifth wave started, we have agreed on a low-fee arrangement for hospital beds with 2 private hospitals. We started a collaboration with private hospitals where appropriate patients, including COVID patients, would be referred or transferred to private hospitals. Earlier, the TMHK Medical Center provided 24 hospital beds to receive COVID-19 patients from the HA in stable condition. As to whether designated hospitals would be activated, we would monitor the situation with COVID. as for the low-fee hospital bed arrangement or agreement with the two hospital beds with the two private hospitals, it is still in force, and we are discussing with more private hospitals on the potential arrangements. The HA appreciates the support offered by private hospitals, and we will maintain communication to see how we can take care of all our patients. Next question, please. The gentleman in purple. This is AM 730. I have a question for Professor Lau. The weather is very hot these days, and some patients might be reluctant to speak given the hot weather, or they might be lethargic. So apart from the arrangements you mentioned, how can we find out whether the patients are in such lethargic conditions? Apart from the eldest sister of the child, did any other family members of that girl test positive? Did she go to the Chengshao Hospital on her own accord, or did she call for emergency service for the public-private partnership mentioned yesterday? For the 364 hospital beds, how many would cater for COVID-19 patients? And would only a single hospital receive patients? Are there any differences between the previous collaboration with private hospitals and the current one? Professor Lau. Things are indeed not simple. That's why we are doing our best job of explaining the arrangements. Given the hot weather these days, if a patient is dehydrated or if the room temperature is too high, they might suffer lethargy. And so where conditions permit, air conditioning should be turned on, and everyone should be well hydrated. And if the children appear to be less active than usual, then you may pay special attention. You should play with them and talk to them every now and then and make sure they are well hydrated and maintain an appropriate room temperature. So if children have fever, and well, children might not go out a lot, and they are less likely to suffer a heat stroke at home, unless the conditions at home are stuffy or families living in cage housing. So I think the grassroots families are the ones who are suffering the most in Hong Kong, and they need the best support. So for those who are concerned, they should seek medical attention, and they should not take any chances with their health conditions. So if they are in doubt, they should see a doctor.
Dr. Kwan, with regard to our collaboration with private hospitals, we're now communicating with private hospitals. Some stable COVID patients may be taken care of by private hospitals, but we're still discussing with them the model. As for our prior mode of collaboration, it was effective. So we like to maintain flexibility in our operation to see how with public and private sector collaboration we can help our patients. When you as for the 22-month daughter baby, as far as I know, the RAT results of parents are negative, but I don't have the time frame with me. I'm from Mingpao. For the 22-month-old baby girl, was she tested before administration? And then if the domestic helper was positive, did she declare, and was she sent to quarantine? And for children not yet old enough for vaccination, what protection can we give them? And for those between 6 months and 3 years old, we do not have any data on vaccination. Will there be any risk of vaccination? And for the 3-year-old baby, what is the major subvariants of COVID affecting them? And for HA, I'd like to know how soon can patients be transferred to private hospitals? What types of patient do you expect? Will there be patients requiring rehabilitation as a result? Turnover of beds may be slow. No, we're not talking about the foreign domestic helper. Rather, a 3-year-old elder sister tested positive by RAT. I did not ask the family myself. The information was passed on to me through WhatsApp messages. So I was not talking about a foreign domestic helper, but a 3-year-old elder sister, RAT positive. I believe the sister would be in school, so she was required to do daily RAT. So the family was very alert. The younger sister had fever, so they were worried that she might have been infected. So that means daily RAT requirements of schools have give some warning to the parents. Unfortunately, they live in a rather remote island, not even on Changchao. So that was that delay of 1 day. And as for vaccination for those younger than 3 years, you might have known that the U.S. have already allowed vaccination for those below 3 years of BioNTech. It's only diluted 1/3 of the dosage for adults. Personally, now I'm talk about my own opinion, not that of the committee, because everyone is entitled to his own assessments and judgment. Now, these joint scientific committees are going to meet next week, and I cannot really influence the decision. I'm just one of the chairmen. We're going to have a discussion next week, and we'll come to a conclusion. BioNTech vaccination has started in the U.S. Israel is among the most aggressive countries, and Israel has started giving this vaccine to young kids. The U.S. and Israel aside, I know that a couple of countries have started to do this, including Canada, Australia. As for Singapore, they're now considering this. But according to social media, Singapore may start to provide the vaccine for young kids in the fourth quarter. As we all know, this is a high-risk group. And in U.S., the number of cases is very high, and many people have been infected and have problems. I've said on various occasions that for Sinovac, there are data covering 10,000 or so subjects for aged between 6 months to 17 or 18 months. And in South Africa, they have done a study involving 100, and some have got placebo, and some have got 2 doses. So they use immunoadjustment system. After vaccination, if the immunity is the same or superior to adults, then that means the vaccine is useful for decades. This has been used to conclude whether a vaccine is effective or not. The same has been done in Hong Kong. For instance, for Sinovac, we use this method to decide to administer the vaccine on primary, secondary schools, and even KG schools. So we do not need to use the conclusion of a typical third-stage clinical trial. So I believe both vaccines should be useful to reduce the possibility of severe cases or even death among young kids. Now, for the volume of data, we can only apply the vaccine to 1,000 or so young children. So we look at the total population. If hundreds of millions of people have been vaccinated, I'm sure all side effects are known to us. Now, my personal opinion, I'm not representing the joint scientific committees. My personal opinion is that the two vaccines are safe, and my inclination is to allow parents to choose one of the vaccines as soon as possible. I understand that some parents may be worried. My view is we are just giving this option to parents. They can choose to take the vaccine or not, and the important thing is to be transparent. Dr. Kwan, with regard to our cooperation with private hospitals, we will see whether we can transfer stable COVID patients and some non-COVID patients, and maybe short-term rehabilitation patients. And these are appropriate cases, and we'll review them one by one. We're now communicating with private hospitals because we have to discuss with frontline colleagues of different clusters to see how that can operate. So we are working on the advanced work, and if everything is ready, the scheme can kick off. The lady in the third row. Speaker is off mic. I'm from cable TV. Professor Lau, you talked about immunity adjustment data. Now, if you don't have clinical data for the third stage of trial, how can you ensure that the vaccines are safe to very young kids? And yesterday it was said that the prescription of new COVID drugs to the elderly was on the low side. Can there be any pre-authorization to expedite the prescription of such medication? Will HA consider this possibility? Professor Lau. First, BioNTech. You may have forgotten that earlier this year, data was submitted on administration of 2 doses, but that was not sufficient. And then the manufacturer talked about the third dose. The design of the third dose was very complicated. It was called stage 2/3. 4,000 kids aged between 6 months and 5 years old. They were divided into 2 groups, one given placebo, which was just a saline, and the other was given the vaccine. And then the test progresses. Strictly speaking, the data was not really a third-stage trial, but we do understand that when we have a pandemic, and if we are very rigid and we use a third-stage clinical trial as the golden standard, it is not feasible. If we adopt this golden standard of a third-stage clinical trial for the age group 2 to 5 years old, 2 out of 600 were infected. For those who were given saline, it was 5 out of 600, so it's useless. So for 6 months to 2 years, it's 2 out of 180 and 2 out of 3. So perhaps we should not really emphasize too much this golden standard of third-stage clinical trial. In fact, compared with adolescents and adults and young kids, well, the effect was quite good, and 3 doses are required to give protection against BA.1. And the same goes for BioNTech and Sinovac. Now, for Sinovac, the test was done in South Africa, which is a very outstanding country. Well, Omicron appeared in South Africa in late last year, and within a couple of weeks, they already sounded warning to the whole world. They conducted the trial on 200. Some were infected, some are not yet infected. The immunity was comparable to adults after vaccination, and some even superior. We have all heard the term hybrid immunity. Hybrid immunity. For those already infected and received the vaccine, of course, the immunity will be greatly boosted. And those with 2 doses but not yet infected, the immunity is still good, comparable to that of adults, but not as good as those who have been infected and vaccinated as well. Now, if you have not received any vaccine, then your immunity is very, very low. We've already got this literature published. So if you've been infected, don't think that you don't need to receive any vaccine. You should still receive a vaccine. Of course, I hope you can be vaccinated first before you get infected. Then the possibility of long COVID would be much lower. And then for young children, the possibility of multi-dysfunction would be much lower. We have sufficient vaccines for 7.5 million. So, of course, I want all of us to be fully vaccinated.
開放自由度就咁感染呢？
For if unvaccinated children under the age of 3 or elderly people who are not fully vaccinated, it would be unfortunate if they are infected. So let's give this some time. Dr. Kwan? As for the prescription of oral antivirals for elderly patients, this is something we are monitoring. And like we said in recent days, we have been trying to use different channels for elderly patients or family members who test positive through RAT. The results should be reported, and they can seek support from us through different channels. These include designated clinics, a support hotline, and today we commenced the booking function under HA Go, and telemedicine service could be booked. So for Hong Kong residents above the age of 18 who tested positive, they can use this service, and the telemedicine service is available 7 days a week. And for patients who need to be prescribed with drugs, they would be delivered within 1 or 2 days. So we would reach out to patients through different channels, and if they experience any symptoms, they should seek medical attention, because the earlier they begin taking oral antivirals, the better the effect would be. And for elderly people who are yet to be fully vaccinated, please do so as soon as possible. Final question for the day.
Okay, so Professor Lau, can you recap in English about the situation of the 22-month-old patient and about the brain inflammation? Is this common on kids, and is this a worrying situation in Hong Kong because these young kids cannot get the vaccines? So what can be done for them, and do you think there's a need to lower the vaccine age limit? And for the HA, why is there a need to impose tougher testing rules for public hospitals, and who exactly does the requirement apply to? Will this pose a problem for the elderly patients who have to go to hospitals frequently for checkups and appointments? And also about transferring patients from public hospitals to private hospitals, like a private hospital representative said most private hospitals are actually not equipped to take in COVID patients. So what kind of patients will be transferred to private hospitals, and how will the private hospitals cooperate with the public ones with the expectation of a rise in the number of COVID cases? And will the HA adjust services for non-COVID patients as well? Thank you.
Professor Lam first.
So regarding the 22-month-old girl, from the information I've got, the child had a fever, chills and rigors yesterday, and then had some twitching and noted around 7 o'clock in the evening. And then obviously parents raised alarm because their 3-year-old sister was tested RAT positive on the 27th. Within a short time, I think they already managed to go to St. John Hospital and consult what we call the FM, that is the family medicine, and the notes were retrieved from the electronic sort of medical records, what we call the EPR. So at that time, that is in 2030, that is 8:30, it was already accompanied with the ambulance crew and noted to have a very fast pulse rate, over 200 per minute, temperature 41.4. And then at that time was given, I think, some antipyretic rectally, and finally with the flying ambulance service managed to transfer the case to PYNH A&E department at around 9:30. Of course, at that time, the overall impression is that this is a COVID-related encephalopathy with very little chest involvement. That is not a pneumonia case. And that could be quite classical for little children under 3 or 4 years of age who had flu or other viral infection, in this case COVID-19, and developed brain inflammation. And then from what I could gather from speaking with my colleagues in PYNH, the child was already investigated very thoroughly and supported appropriately in ICU, intubated with all the medication required to sustain life. Already had the full lead EEG, which was of low activity, had a CT scan done, and an MRI of the brain was done this afternoon. And while I was speaking earlier, my colleague already WhatsApped me on the report of the MRI showing a lot of brain edema. That means a lot of swelling causing compression on the brain. So the child received appropriate treatment for the brain swelling as well. So the message here is Omicron, as we know now, from what we've already learned from the 5th wave, the BA.2 could cause very serious neurological complication, including what we call the acute necrotizing encephalitis, as well as febrile convulsion. And if the convulsion is prolonged and a child not getting appropriate treatment, that could result in what we call hypoxia, damage of the brain, and that would lead to very severe consequence. So the message to the public here is to let them know Omicron is not a minor flu. Of course, in most cases, they are not so severe, but in some cases, they can be very severe. And the only way to reduce this complication is vaccination. And of course, we understand there's no vaccines available for children under 3 years of age now, but in Hong Kong, we do have access to the 2 vaccines, which are already given to over 90% of the population. So we have accrued enough knowledge in terms of the safety aspects, both the CoronaVac and the BioNTech. So this is my own personal opinion, not that of Joint Scientific Committee. From what I could gather in terms of a total body knowledge, these 2 vaccines are effective for children under 3 years of age to reduce severe cases and deaths and complications arising from COVID-19 infection. And in terms of the safety, I feel because the large number of doses already given to adults, young people, adolescents, kindergarten children, in the case of CoronaVac, my own personal view, it's also safe. So in short, I think these two vaccines are effective and safe for children under 3 years of age. But of course, I stress this is my own personal view, and the whole matter still need to be discussed thoroughly, seriously, by all the members of the JSC next week. In the meantime, the only thing we can do is to call our parents in Hong Kong to take your children for the vaccination as soon as possible if it's available for you. For those under 3, I will do my very best to present my view to the JSC next week. Thank you.
Dr. Grant, please.
Okay. So for the visitation arrangements, so as said previously, we are aware that the hospital is an important place to safeguard because our patient is very vulnerable to any infections. So apart from the increased enhancement in the surveillance for our staff as well as our patients, so that's why we have these new arrangements. So this applies to those with special arrangement, visiting arrangement, not apply to those elderly who are already a patient. They may come to the hospital to seek medical services. These are not considered as the visitors. And the sole purpose is to enhance the infection control issues. And for compassionate visits, the arrangement is still staying the same because we are trying to arrange to allow the feasibility for the family members to visit the patients when they are in a situation when the condition is critical or dying situations. And for the private and the public collaboration supporting the COVID patients, tentatively we will probably have download those or transfer those patients with stable COVID condition or those non-COVID patients who may need a short period of rehabilitation. But this all still subject to further discussion and arrangement. We are aware of the difficulties and also the hardware set up in the private hospitals. So we are still in the process of discussion with them and to see how we can better utilize these resources, support from the private sectors. And lastly, you mentioned about the service adjustments. So we are in the phase 2 of our bed mobilization plan. So some of the hospital may already have slightly adjust their services like the non-emergency surgery or some diagnostic examinations. But we don't have figures to say when to or how much we will reduce our services because we have to balance the risk between those COVID and non-COVID patients. So we will keep in view of the current situation and adjust our services accordingly. Thank you.
今日記者會完結，多謝大家。The PB ends here. Thank you very much.